Hey, what's up guys? It's Dave with another video. Today I want to go over my vehicle first aid kit and trauma pack. So for starters, this is a pack that I keep in my truck with me at all times. The purpose of this pack is, well, there's two purposes. One is to administer first aid in the event of an automobile accident, and the other is to just have some medical and emergency resources with me that I know are going to be right there in my truck. The bag only leaves my truck if I am restocking the bag, checking expiration dates, or shooting a video for YouTube. I recommend that everybody keeps a bag like this in their vehicle, even if you're not going to stop and administer aid on the side of the road. It's just something nice to have in the event that you are in an emergency. There are circumstances where it is not safe for you to stop. Depending on the road conditions, depending on the time of day, I wouldn't recommend that anybody stops to administer aid with the scene of an accident. If you come up on that accident, it is raining, it is snowing, it is foggy, and it is nighttime, and you are not sure of your own safety. In those cases, it's best to set yourself apart and away from that accident, and preferably drive past the accident scene and allow that scene to create a block for yourself, and dial 911. Let the big vehicles with the flashing lights come out and administer aid. But of course, there are going to be times where you might come across somebody who does need help and you're in a safe position to do so. So a bag like this would definitely help in that circumstance. For the bag itself, this is the Rip-away Condor EMT pouch. It's the regular size. I don't really know the specs of this pouch off the top of my head. I know that I've had it for several years. I love the pouch, and there's plenty of videos on YouTube where you can actually go over and just review the pouch. This is not about the bag. This is about what's in it. All right, so the pouch itself, I will note this, which is really cool. You have MOLLE webbing on the back of the pouch, and you have this Rip-away Velcro panel. So what a lot of people do is they fashion this to the back of their seat or some other part of their vehicle, and they make it so that the pouch itself can be ripped away right here, and they can just kind of rip it and go. So that's the purpose for that element within this pouch. First thing that you'll see right here, it's hanging off of the bag, so I never lose it, never forget it's here. I have a CPR Rescue Mask, which contains both the face masks for an infant and an adult. All right, so I have that. It has a one-way valve to provide rescue breathing in the event that somebody needs it. I also have this very inexpensive Keychain Flashlight. I have better flashlights that are in my vehicle, and this is just something that I'm going to keep on this bag as a redundancy item, and this is something that will help me to see around the bag at night. This is not really for scene lighting. This is to help me see what I'm finding in this kit. Right off the top of the bat, if I'm going to administer first aid, I'm going to want to glove up and don some PPE. So I have one pair of nitrile gloves in the webbing on the front ready to go. I've also got a pen light right here on the front. This is great for assessing your patient. It's good for looking in wounds, checking their pupils. You can do a lot of good just by having a decent pen light right here. I have a pair of trauma shears for cutting away clothing, for cutting tape and bandages. Keep those mounted right on the front as well. This tool here is really great. This is made by Stat Gear, and I forget the name of this tool exactly, but this is a Stylus. It also has a switchblade style seatbelt cutter, and it can be unscrewed to reveal a window punch and an oxygen wrench right there. So it's a great tool for an EMT. I worked as an EMT for 7 years. So it was an awesome little gadget for me to have with me, especially because we started using touch screens to take patient signatures and things like that, and for our documentation, writing patient charts. So I could use the Stylus in that capacity. On top of this pouch, under this strap here and under a Velcro strap, I have a tactical tourniquet. Getting inside the bag now, opening up, you're going to see that there's a lot in this bag. Okay, and the bag basically breaks down into 3 compartments. So we'll start right up here at the top. I have some tape. I have right here, there's a safety pin for fashioning bandages and possibly attaching a triage tag to a patient. I have Sharpie marker for writing things. If we're applying a tourniquet, we're going to write on that patient, sometimes right across their forehead, the letter T and the exact time that the tourniquet was applied. These tourniquets do have a spot somewhere along here which is white fabric so that you can write the time that it's been placed. But if there's other important notes, you have a Sharpie. I have several saline flushes here that can be used to clean out wounds. I've got a quick clot sports bandage. It's hemostatic gauze to help stop bleeding. This can be packed into a wound. I have a Vaseline gauze here, which can be used as an occlusive dressing to stop a sucking chest wound. It can be applied with tape on 3 sides. The packaging itself can also be used as a chest seal. I don't carry a dedicated chest seal in this pack. To be honest, they're not just the most budget-friendly thing in the world, and they can be improvised pretty well. This is my blood-stopping compartment. I just have some gauze. I have 4x4s. I have 5x7 abdominal pads, and I have some real nice big Tegaderm film dressings, which I like for first aid purposes. They can be cut to different sizes to match different applications. So that's what we have in this compartment right here. This is our blood-stopping compartment. Moving down the row here, I've got more gloves. These are heavy-duty nitrile gloves. These are going to protect your hands, and they're rip-resistant, so you can use these around automobiles, wreckage, in rescues, outdoor applications, and things like that. I've got some roll dressing right here. I've got some open pieces of roll gauze, and I have a triangular bandage with a safety pin contained in here. This can be used almost like a MacGyver tool for first aid. It can be used to make a pressure dressing, a secondary tourniquet. It can be used for a sling and swath, all different applications for a cravat. On this side along here, when you have a patient that's out in the elements, it's likely that they're going to become hypothermic if they're burned or injured in any other way. So I keep a cheap fold-up space blanket right here, never been opened, so it's nice and flat, and this could reflect a lot of their body heat back to them, prevent hypothermia. I have a whole stack here of nice big alcohol swabs. They're for first aid application. They're for sterilizing. They can be used in lieu of hand sanitizer to clean your hands. So there's a lot of uses for those, and that's why I pack so many of them in this bag. In this old Band-Aid box here, this was like its own little CVS first aid kit. But you can see right here what I have inside. I've got hand wipes, alcohol prep pads, more of them. I have, what is that even supposed to say? Oh, creams and ointments and liquid bandage. So without kind of picking the whole pack apart, you can see here I've got some hand sanitizer packets. I keep a chapstick in there and just some other smaller first aid type items. And in the zipper pouch right here, we have one nasopharyngeal airway, also called an NPA or a nasal trumpet. This is for securing somebody's airway in the event that they are unconscious. I also have one packet of lubrication to go along with the NPA so that it can slide in more easily. In an emergency, you can use the patient's own saliva for that purpose. I have an OPA, or oropharyngeal airway, as well, and this can be inserted into the patient's mouth to secure an airway if they are unconscious and they're not capable of maintaining their own airway. I have a second roll of tape. This is silk tape. I have some extra small, not that they're extra small, but just some extra small gauze pads. I have eye pads and an assortment of Band-Aids. I keep some blue Band-Aids in here as well. These are good for use on when I used to work as a chef. I liked having blue Band-Aids because, God forbid, that thing falls off your finger and ends up in somebody's casserole, then you're able to spot it. So we've got just our little boo-boo kit here with some Bacitracin Ointment, some Neosporin, some burn cream. And what I always keep in all my medical kits here, a little pack of aspirin in the event that somebody's displaying symptoms of a heart attack. So I hope you enjoyed the quick view into my automobile trauma kit here. The best thing to do with a kit like this is to customize the kit for exactly what your needs are and your skill level. You may not be loading up on airways, adjunct airways, if you have never been trained in their use. I worked for 7 years as an EMT. I work now as a cardiology nurse. I've used them plenty of times, and I would feel comfortable using them. If you don't, then you have a choice to make. You can purchase these items, keep them in your kit in the event that there is somebody present when they're needed, and they can use that equipment, or you can omit them from your kit. Just remember, what kind of emergency are you responding to if you are showing up first on the scene of an automobile accident? Okay, you're going to be looking at traumatic injuries. You're going to be looking at possibly broken bones, blood loss, things like that. You may have an unconscious patient there. The purpose of this kit is so that you can render emergency aid to yourself, to a loved one, or to a stranger that needs it, in between the time that it'll take you to get there and the time that an ambulance or other first responders can get on the scene, and they're going to be more well prepared and more outfitted to handle that emergency. So guys, if you enjoyed this video, please give it a like and a thumbs up. If you have any questions, comments, anything I can add to this, anything you think is just completely pointless and you want me to take it out of here, I'm always open to suggestions. Really appreciate your views and your support. I look forward to seeing you on my next video. Thanks.